Hi there, and thanks for tuning in. My next few posts will be audio recordings only. This is due to the fact that I'm currently away from home and not in a suitable environment for using cameras and producing videos. If you prefer reading, I will post a transcript of these presentations as well. Again, thanks for listening. Wednesday, February 26th. 2 months to the day since my total knee replacement surgery took place. We mark the day by checking into the ER at Baylor Frisco for a second surgical procedure to address infection that has most likely set into my knee joint. To briefly recap how we got to this day, I had a follow-up appointment with my orthopedic doctor on February 6. That was 6 weeks after surgery. Leading into that appointment, I was having good days and not so good days. Days when I felt very positive about my PT work and days when I did not. Instead of progress being up and to the right, I was all over the charts. My knee joint continued to be red and warm to the touch. I had also begun to experience the sensation of a single band of duct tape wrapped around my knee. It felt constricted and increasingly inflexible. Needless to say, my doctor was not satisfied with the level of progress achieved. Extension had increased little, if any, and flexion was barely above 90 degrees. Furthermore, my gait on that particular morning was not very good. Following a quick assessment of my status, he was concerned that scar tissue was beginning to accumulate, and if left alone, would continue to further restrict the rehab process. He strongly recommended the knee manipulation, a non-surgical procedure where he would put me under anesthesia and physically flex and extend the knee for the purpose of breaking down any buildup of scar tissue. This would reset and jumpstart the rehab process. The knee manipulation occurred Thursday morning, February 13th, 7 weeks post-surgery. Everything went according to plan. That afternoon, the doctor's office called, directing me to get some blood work done. The doctor also ordered daily physical therapy sessions for the week following manipulation. In my view, those sessions started very well. Through massage, stretching, and strength activities, we saw gains in my range of motion. While I was still behind the expected rate of development, but things seemed to be back on track. I had a good follow-up visit with the doctor on that Wednesday, February 19th. He noted improvement in the range of motion, and my walking was as good as it had ever been. He brought up a concern regarding infection in the knee, noting that the blood results showed elevated levels on markers related to inflammation and infection. However, these markers were not high enough to suggest a definite problem. To further research that concern, he drained approximately 20 cc's of fluid from my knee and sent it off for analysis. Results of that test would become available in a few days to a week. He noted that his group of doctors had an orthopedic infection specialist in the group, and he would be consulting with that doctor regarding my case. As we moved through that week of 5 consecutive days of therapy, my therapist and I noticed that swelling was again becoming problematic. Through massage, he was able to assist the joint in moving, but noted that resistance was due to accumulation of fluids rather than muscle stiffness. We also noted continued redness and heat, especially on the inside parts of the knee. While I never spiked a fever, I had begun to experience full-body chills during the day, and deep sweats were taking place during the night. These symptoms persisted through the weekend and remained present Monday morning when I went to PT. On Tuesday, February 25th, I woke to find a blister had developed on the incision line of my original surgery. I took a couple of pictures of it as documentation. Robin and I discussed whether we should go ahead and contact the doctor or just wait until the next day and bring these to his attention at our regularly scheduled appointment. We decided on the latter option of just waiting. I took Robin to work that morning, and when I returned home, the blister appeared to have grown larger in just the few hours I had been awake. I took another photo to document how tall it was becoming. At that point, I was going to take a shower to get ready for my activities of the day, and during the shower, the blister popped. I observed a clear fluid oozing from the site, mixed with a little blood. After approximately 30 minutes of time, the oozing stopped, and I was able to cover the site with a Band-Aid. After another conversation with Robin, I decided to go ahead and forward the images of the blister to my doctor, believing he needed to see this information today rather than waiting until tomorrow. I sent that email to his staff at approximately 10 a.m. Around 1:15 p.m., the doctor's office called and reported that after showing my photos to the doctor, he had decided to refer my case to the infection specialist and, quote, could I come in that afternoon at 4 o'clock to meet with him, unquote. The speed at which this referral occurred communicated to me that there might be some urgency to my situation. I picked Robin up from work, and we went to the office and were able to begin our visit with the infection specialist around 4:45 or so. He noted, as my surgeon had previously stated, that my blood work and now the knee fluid cultures taken the previous week showed elevated counts in markers associated with infection. However, again, numbers in both tests were not elevated enough to confirm that infection was actually taking place. He did spend quite a bit of time looking and observing the knee itself. He noted the redness accompanied now by some deep purple colors on the skin, the heat emanating from the side of the knee, and the blister. He asked lots of questions about what I was feeling and noticing myself during PT and at other times. He then asked me to flex the knee as much as possible. The knee flexion created additional pressure inside the knee, and fluid again began to emanate from the blister. At this point, he did observe some pus coming out as well. This observation was the last straw for him. He looked at Robin and I and said, quote, we need to get into surgery. I might be able to get you on my schedule tomorrow. Once again, the immediacy of this reaction communicated my situation was not something to be trifled with. Any delay would only result in a worsening of the current condition. We said, put me on the schedule. He said I would probably be added to the schedule around 3 o'clock and that his scheduler would be in contact with us early the next morning to give us final details. Surgery would be done at Baylor Scott & White in Frisco, and that I should plan to arrive around 10 or 10:30 a.m. It was at that point he also mentioned that I might be in the hospital for 2 or 3 nights. That was a bit of shock until we came to understand the process of infection control and what the infection control doctors had to observe before they would agree to send me home. If you are following along this Netflix episode, the flashback is now over, and we are at surgery day. It's about 9:15 a.m., and I haven't yet heard from the scheduler, so I call him. His information indicates surgery will now occur around 5 p.m., and that I should plan to arrive at the hospital around 11:30. We followed that guidance and arrived at the hospital, checked in through the emergency room, and entered one of their treatment rooms to wait. An operating room nurse came and met with us around 4:30 p.m. She informed us that the surgery might be an hour and a half away. My doctor also came in for a brief visit to make sure everything was okay and answer any lingering questions, and then left to go perform a hip replacement surgery, after which I would be next in line. We continued to wait, and the change of shift for the hospital staff occurred around 7 p.m. Now a new operating room nurse came by for a visit to introduce herself and update our timeline. I didn't get into the surgical unit until 7:20 p.m. What was supposed to be a 30-minute procedure turned into 2 hours, if not a little bit more. When I woke up from anesthesia in the recovery area, the time was 10:48 p.m. I was hurting. Due to the nature of the surgery, they could not use any type of nerve blockers, only general anesthesia. I know I was making the recovery nurse upset because she wanted to help, but she had maxed out her available options for addressing pain. I was the only patient in the recovery room with only 2 staffers present. It felt pretty weird. Around 11:15, I asked them to bring Robin back to the recovery area. Having her there made things feel a bit better. The pain finally subsided to a tolerable level around 11:45 p.m., and I was dismissed from the recovery room and transported to my hospital room around midnight. I did not get to talk to the doctor that night, but Robin did. Apparently, I had significant soft tissue damage, and the joint capsule of the knee was punctured by the infection. The puncture had to be repaired with something similar to a skin graft. That repair was a drama in and of itself because it required special patches that had to be released through a special gatekeeper in the hospital. So lots of drama associated with that 2 hours of my surgery. The bottom line, as a result, I have a well-wrapped brace that restricts any bending of my leg to allow the graft to heal properly. I think that brings us up to date. As always, thank you for your care and concern during these days. I will post again when further information is available. Take care.